So Dr. Anjali, welcome to Big FM. So today we are going to talk about female incontinence. So
Yes,
पहला सवाल मेरा यही होने वाला है कि what exactly is female incontinence?
female incontinence is an accidental bladder leakage. जब भी आप चाहते हैं कि यूरिन ना हो और इवन अ सिंगल ड्रॉप ऑफ यूरिन अगर लीक हो, दैट इज कॉल्ड एज यूरिनरी इनकॉन्टिनेंस. आपके कंट्रोल में नहीं है और आपने यूरिन लीक किया, वेदर इट इज अ कंप्लीट लीक और इट इज इवन अ सिंगल ड्रॉप, दैट इज यूरिनरी इनकॉन्टिनेंस.
Okay, but also doctor, we have seen like sometimes it happens अगर आप कहीं बाहर हो, you are not able to go to the toilet quickly, or like the toilets are dirty, so mainly people avoid going at such places. So उस time पे भी ऐसे होता है, and in fact like whenever someone sneezes or coughing होती है, so leakage हो जाता है. So for that, like, are these the examples of incontinence?
Yes, it's a nice question. It totally differentiates your incontinence. There are various types of incontinence. जो आपने पहले बात किया कि आप ज्यादा होल्ड करते हैं, तो ज्यादा होल्ड करने के बाद वो ब्लैडर को थोड़ा इरिटेट होता है, एंड दैट इज अ डिफरेंट और इट्स अ फंक्शनल इनकॉन्टिनेंस. खांसी करने के बाद या स्नीजिंग के बाद या कभी ज्यादा हेवी लिफ्ट वेट लिफ्ट करे तो लीक हुआ, तो दैट इज योर स्ट्रेस यूरिनरी इनकॉन्टिनेंस. बेसिकली स्ट्रेस यूरिनरी इनकॉन्टिनेंस ये थोड़ा एब्डोमिनल प्रेशर अगर बढ़ा है और ब्लैडर में थोड़ा यूरिन हो तो इट लीक्स यूरिन. नॉर्मली द यूरेथ्रा, जो ट्यूब छोटी सी रहती है पेशाब बाहर आने के लिए, दैट इज बेसिकली ये बंद हो जाती है. Whenever you cough or you sneeze and there's an increased abdominal pressure, there's always a support or a sphincter there which closes. तो opening close होने के कारण leak नहीं होते. But for some reasons, कि जैसे pelvic exercise, pelvic muscles lose हुए हो, उनका tone कम हुआ हो, तो वो support निकल जाता है, and that is how patients leak urine. That is called as a stress urinary incontinence.
Okay, okay. And if I ask you, like, how common is UI in Indian women? So, what will be your answer?
Oh, it is very common. There was a study conducted in 2013 in 3,000 women where we have found out that almost 22% are incontinent. That is, if you see, it is 1 in 5 women, it is common. And out of that, 70% is stress urinary incontinence, and 30% is either urge incontinence, or mixed one.
Okay, and what are the risk factors of urinary incontinence in women?
The risk factors are pregnancy, vaginal deliveries, which stretch the pelvic muscles, obesity, diabetes, menopause, where there are a lot of hormonal changes, after hysterectomy, or that is the uterus removal or cesarean, or any sort of catheterization which has been done post any big surgery, or any cases, neurological cases, Parkinson's ho, multiple sclerosis, or spinal cord ka problems ho, or the important one or the basic one, urinary tract infection. Even this can have a little amount of urgency because the bladder is quite irritant, or the bladder is quite affected in urinary infections.
Okay, and I'm sure हमारी ये बातें सुन के बहुत सारे लोगों के जहन में ये सवाल जरूर होगा that is UI treatable?
Of course, it is treatable. It is a myth that it is a part of aging and there is nothing can be done about it. Of course, it can be treated earlier, the better. So, whenever you have any symptoms, you're supposed to approach a urologist, get yourself investigated and managed accordingly.
Okay, and also like several women are very anxious about getting all the like tests done. So are these kind of tests like really scary?
No, no, of course not. These tests are not at all scary. These are very basic tests. The first of all, we ask for a basic urinary routine test. Then we ask for a sonography. Sonography, importantly, we understand how the internal organs are placed because we cannot see anything from outside. So how is the bladder, how is the structure of the bladder, or how is the post void residue? I would like to stress here and tell that the post void residue, which means that after you've passed urine, how much is the urine remaining behind? आप पेशाब होने के बाद कितना पीछे रह जाता है, ये इंपॉर्टेंट फैक्टर है जो हमें बताता है कि ब्लैडर कितना अफेक्ट हुआ है. एक बार प्रेशर निकल गया तो पेशेंट फील्स दैट ही इज कंप्लीटली voided, but there may be some residue which is remaining behind, and that tells us that the functioning of the bladder is definitely affected.
Okay. And like, could you just elaborate on the urodynamic testing?
Yes, I do a lot of urodynamic test, and it is a very good test to really diagnose which type of incontinence it is. It is not only on clinical judgment or on your examination or your sonography findings, but urodynamic clearly tells us कि bladder कैसा काम कर रहा है, whether the bladder function, उसका pressures कैसे है, how is the speed of urine which is coming out, कितने फोर्स से आ रहा है, and what kind of management would really improve this bladder or keep it at a stable stage.
Okay. And how are these urodynamic tests done?
These are very simple tests to say, but it's not actually that way. You have to take a prior appointment because it's an invasive thing. It's not something you just walk into the room and it is done. You are prepared for this test. After the basic investigations have been done, a urologist will advise a urodynamic as the end investigation. When no medicines are acting, when everything is done and still the patient is really suffering, then this test is advised. Wherein I would like to just briefly tell you how this test is performed. There are small tubes which are put into the urethra, which goes into the bladder, and one in the rectum. This will tell me the abdominal pressure and the bladder pressure. These tubings are then attached to the computer where there's a software which calculates and tells me the bladder detrusor pressures. That is, how is the bladder functioning when we are filling in the bladder. जैसे हम किडनी से यूरिन आता है, bladder full होता है, and then you pass urine. But here we are doing it ourselves. We are filling in bladder, so we get, when we are filling in bladder, how is the bladder really working. And when the patient is full, the patient has to pass urine, and then when the patient is passing urine, how is the pressure, how is the flow, and the complete functioning of the bladder can be made out.
And like, what should one do to prepare for urodynamic tests?
Yes, first and foremost is they should be free of infection. So in any infective pathology or any signs, symptoms of infection, urodynamics is never done. So a basic urine routine which tells us that the patient is free of infection. No prior fasting or anything is required. You just have to come with a full bladder, so that we first do the uroflow, that is just pass urine, make your bladder empty, and then perform this test. His bowels should be cleared up.
Okay. And like, what can I expect after a urodynamic test?
Yes, a little irritation while passing urine because you have inserted some tubes in the urethra. So obviously the first time or the first void after the procedure may be a little irritable for the patient. There may be some blood which can come out because there's been some friction, but really not to panic at all. These are minor things. So I always ask one of the relative to accompany with the patient so that they are quite comfortable.
Yeah. Okay. And like, what are some general lifestyle measures which, doctor, you will tell all the women which will help them to prevent UI?
The general lifestyles are, yes, the good fluid intake, that is at least 8 to 10 glasses of water is a must. Plus, it should be alkaline. So, lot of lemon water has to be taken, lot of fruit juices, lot of buttermilk. All this has to be taken. Avoid bladder irritants like tea, coffee, smoking, alcohol. If you're obese, see that your weight is under control. Control of diabetes is on a priority basis. then you are not supposed to hold on urine for long. This will irritate the bladder, plus you will be prone for urine infections. Since I'm mentioning this not to hold on urine, it's very important because in school
Right.
going people or college, for work, they hold on urine for long. And that
Correct.
is how, because of the continuous stretch on the bladder becomes a little loose. It loses its tone, and these are the patients can land up in urine infection, or there's another entity called as overflow incontinence, wherein there's lot of residue and it just overflows. That is how these people will land up with an overflow incontinence. And not but the least that you should get regular checkups done and manage at the earliest.
Okay. And since doctor, pandemic is going on, so what precautions one should take care during COVID? What will you suggest to everyone?
Avoid infections and visits to the hospital. So again, the same, good amount of fluids, not to hold urine, good exercises, pelvic exercises plus a general exercises to maintain your body weight is a must. Now, pelvic exercises are for your pelvic muscles. Now, these will tighten or these will increase the tone of your pelvic muscle side. This training will be given by a concerned either a urologist or a gynecologist, but all females who are multipara or those who have had deliveries, they should do these pelvic exercises.
Wow. So that's one like very important thing which you have said, to do pelvic exercise. That's a
Yes,
must for everyone.
yes.
Thank you so much, Dr. Anjali, for giving us time and giving us so much information about UI.
It's been a pleasure talking to you, and I
Same
hope that
here.
all my patients will be benefited by this. Thank you so
Same.
much.
Thank you so much, Doctor.